after 3 cycles of chemotherapy, halfway through her treatment, they went and did another PET scan. There was no evidence of cancer.
Hey everyone, welcome to today's episode of the Beljanski Cancer Talk Show. We are pleased to welcome back Dr. Richard Powers, a true pioneer in integrative medicine and one of the leading forces in redefining what health and wellness look like. Dr. Richard Powers is an innovator in integrative medicine, putting together more than 2,000 hours of training. He's considered the doctor's doctor, the one doctors go to when they need answers. Get ready to redefine wellness from the inside out.
Hello, Dr. Powers, and welcome back. I'm delighted to have you again on the Beljanski Cancer Talk Show to speak about your practice and how you have incorporated the Beljanski products into your practice. Let's say a few words first about your practice. You are an integrative doctor. Where are you located?
Yeah, I'm in Stuart, Florida. I'm in my 44th year of practicing holistic integrative medicine. My job is to help people learn how to get well and stay well.
And unfortunately, in your practice, you see a lot of cancer patients. Is that right? More and more so? Because the number of cancer keeps rising.
Yeah, what happened is each decade passed, the sicker and sicker people, the people that had the more chronic degenerative conditions, the dementia, the cancers, the autoimmune diseases, diabetes, all the really long-term chronic diseases, I started getting more and more of those. And then the last 10 years, it's pretty much the only people that I would see. If someone came to me for an appointment and I'm also a chiropractor, so if they needed chiropractic care, I'd refer them to a chiropractor. I pigeonholed my own practice to take care of those people that are having trouble finding solutions. Yeah. So cancer is certainly
Yeah.
one of those for sure.
Cancer, autoimmune disease has now become your specialty as an integrative doctor. And I think that's very valuable because so many people now are fed up to be prescribed some antibiotic or products, one drug that is going to have so many side effects that eventually they will need a second drug to numb the side effects of the first one. And the real problem, the underlying problem, has not been solved. In your view, as an integrative doctor, what is your approach? How would you walk me through how you deal with a patient for the first time? Or what happens?
Yeah. So I definitely want to connect with what's most important to them because over the years I got wiser and wiser that, like in the beginning, I thought I just had to learn how to fix everything, how to diagnose everything and fix everything. Once I learned quite a bit in that department, I thought I was there. And then I realized no, the art of being a doctor is how to connect with and educate and guide according to what's most important to that person and how their brain thinks. I have lots of tools at my disposal to diagnose and lots of things in my treatment arsenal. But the most important thing is to connect mind to mind, connect heart to heart, and find out what's in their mind, what are their struggles, what is it that they want. Obviously, they want to feel better, but I let them talk and let them reveal to me what's most important to them and let them know that I understand what they've been through. And then, of course, to empathize about that. And then to share my paradigm, which they already understood quite a bit. That's why they made an appointment. But I made sure that they're clear that really what it boils down to is that we get sick because we're living inconsistent with our natural design. So we don't, and it's so easy to do that now in our 21st century. It's so easy to not live the way our bodies were naturally designed. So we eat food that's ultra processed. Our body's not naturally designed for that. We're exposed to an inordinate amount of chemicals that are all human synthesized that the body wasn't designed really to be exposed to. In fact, a lot of those chemicals are called forever chemicals because the body doesn't know how to break them down. They stay inside and they pretty much get stored in fat cells, which is part of the reasons of the obesity epidemic is there's so much toxins in the environment. But anyway, the point is, I give them the big picture before I dive into details. And the big picture is, if you give your body more of what it wants and less of what it doesn't, then you'll get more of what you want and less of what you don't. And then I let that sink in. I then give them some examples. I said, well, it looks like you've been dealing with XYZ for so long, and I noticed that you're eating this way. I also noticed, and let's face it, dietary habits have a lot to do with it, and chemical toxic exposure and sedentary lifestyles. I always make up that picture where nowadays in the 21st century, you could sit on your couch. You don't have to literally move a finger. You could just say, hey, Siri, your phone answers. Call the pizza parlor. The pizza parlor answers. You say, send me my normal order and don't even knock. Just come on in and put it on my lap. Charge it on my card you have on file. Yes, diet, exercise, and so many pieces, and the chemicals are all big pieces. But another big piece, in fact, I'd say the biggest piece, and these are big pieces that I've mentioned so far, but the biggest piece has to do with here and here. There's so much, the way the world has evolved in our culture, there's not enough connection. And of course, with the digital age and social media, it looks like there's more connection, but in a lot of ways, there's less. And I think that has a huge impact on how we perceive and how we feel stress in our lives. And there's a lot of fake connections, meaning that it's not really heartfelt, and it gives you the illusion that they have friendships. But without those real in person friendships, without the real connections, I think that has a huge impact on how the body can handle our dietary habits and how it drives us to eat the way we eat. It wants us to eat foods that make us feel better because we don't feel so good. And then we're tired, so we don't feel like exercising, even though it's the best thing that we need. And then all that interrupts with our sleep habits. So we don't heal, repair, and detox. So it all rolls forward. So I go over all this in a little video that I share with patients before I ever sit down with them. So that by the time they sit with me, they know where we're coming from, where we're going to be digging into, and then we go from there. And of course, the toolkit is going to be diet and exercise pieces. And I also teach them how to make it easier to adopt healthier diet and lifestyle habits and healthier thinking, and give them tools and techniques and ways to incorporate that, and lots of options, because different people can do different things better than others. Other people, it's, oh, I can go to bed earlier. Other people's, that's not going to happen. So I give people the big picture of what has to happen in that area. And then, of course, there's meeting their fundamental nutritional needs, which we can supplement. So I do testing to help identify where do they need some boning up in the nutrient department. And then there's the natural medicine that helps to support the underlying mechanisms that are a problem. So the first layer of underlying mechanisms might be their gut health. It might be the oxidative stress from toxins in their environment and chemicals that just overloaded. It could be autonomic dysfunction. You hear about vagal stimulators in the vagus and the autonomic nervous system.
Yeah. So for people who have been diagnosed with a serious problem, either an autoimmune disease or a cancer, they need obviously being listened to. They need some dietary guidance, but they need also actual serious treatment. What do you recommend generally to people who are suffering from cancer?
Yeah, so the first thing I think about that I talk to them about, which is why I listen and connect in the beginning, especially with people with any chronic disease, but especially with cancer, is I think of Dr. Kelly Turner's book, Radical Remission, where she studied hundreds of people that were diagnosed with terminal cancer and then sent home. That a lot of them, most of them received conventional treatment and it failed, and it metastasized, and they sent home to hook up with hospice and get their affairs in order. And then she
Yeah,
found,
conventional treatments are chemotherapy, radiotherapy, and surgery,
yeah,
basically.
kill, burn, or poison. So you're trying to, the whole idea with conventional therapy, and there's a place for it for sure, it's to try and attack and kill this cancer cell, but it's not doing anything about what happened that our cells were able to turn uncontrollably into cancer cells, because our cells are always There's cells that are always turning into cancer cells, but at a low rate, and our immune system identifies targets and takes them down. What this woman found is there's certain things that were common of this group of this hundreds and hundreds of people that had terminal cancer, get sent home to die, and they recovered. And she interviewed these people to find out what are the common threads, what happened, and they all had to do with here and here. Now they all had some diet and lifestyle improvements. Obviously, that was important, and they took some supplements. But definitely was absolutely common among all the people that recovered. And this is without getting a lot of the really cool alternative integrative cancer therapies that are available, or even about some of the things that I'm going to talk about that I work with patients here in a few minutes. This is just with some fundamental nutritional supplements, making some good diet and lifestyle changes, processing grief, forgiving themselves, forgiving others, connecting and socializing and opening up their hearts more. Fundamentally, your immune system is directly impacted by the thoughts you think. Your nervous system, your
Yeah.
brain is intrinsically connected to both your hormones as well as to your immune system. We understand and we can hypothesize the mechanisms why these people recovered, but you at least got to consider the part that the mind and unresolved healing and grief that happens between the ears as well as in the heart. So that's a big
Yeah,
part
but
of it as well.
healing the mind and the heart sometimes it's a journey. It's a long process.
Oh, yeah.
It's not like a
Well, that's the
switch
other thing.
you take on and off and on. Therefore, that's why I think it is really important to have other tools that will work at the cellular level to give you the time. You need to support your body. You need to support your healthy cells and your immune system during the time you are going to process this journey of making peace with yourself. And as you said so appropriately, forgive yourself for whatever made you sick in the first place.
Yes, and you made a good point. It's a journey. Cancer is something that doesn't it happen. The average development of cancer journey is estimated to be at least 3 decades. And because it happens one step at a time, and the healing happens one step at a time. But you're absolutely right. What can we do to give someone more time when you approach healing from as many angles as we can simultaneously, but not so much that it's overwhelming? I share different things and I look at the person in their eyes and I see what sticks, what's resonating. When do they start crying? When do they start leaning forward and listening? And so I listen. Okay, so what is it that we can do with diet and lifestyle? What can we do up here with head and heart? What can we do with supplements? What can we do with adjunctive therapies? And circling to one of the main things that I want to make sure we have time to cover is when someone comes to me and they're already diagnosed with cancer and they've decided to get conventional treatment, radiation therapy, chemotherapy, which again, whether it's an immunotherapy, chemotherapy, or a more of a toxic chemical chemotherapy, it's all in the same category. They're trying different ways to kill cancer cells. And a couple of problems, which you're well aware of, is that the traditional approaches to cancer, especially chemotherapy, radiation therapy, the research shows that it has a lot of difficulty actually taking down the cancer stem cells, which is where the cancer cells can regrow all over again. It's like weeding your yard by trimming off the branches and the leaves of all the weeds, but leaving the roots. So then it grows back and you got to keep weeding. Now they don't come back. They have to get brand new seeds to do that. So that's one of the reasons why there's such a recurrence rate with traditional therapies. So when someone comes to me, a case study is a patient that came to me. I actually discovered the cancer by doing some screening tests, a blood test called the Gallery blood test, which anyway, but it popped up as possibly she might have a lymphoma because it identifies the type of cancer. And then I did some testing, and then she went to MD Anderson and went to Moffitt and several clinics, got it confirmed. They said that this will be responsive to chemotherapy, not radiation. That was the choice of conventional treatment. And I don't tell people what to do. First of all, it's not up to me. It's not even within my license. But I think what I do is I give them options. I give them perspective that maybe they wouldn't have otherwise. And then I let them pick and decide. Usually it's a husband and wife or a child or whatever. But I let them decide what feels right. What do you feel most comfortable doing going forward? And this particular person decided to move forward with the chemotherapy. It was unanimous. Cleveland Clinic, Moffitt Center, it was all the same chemo, the same protocol. They all agreed this is how to go. And I've done a lot of research over the years, so I know what I could support in that person to improve the outcomes and decrease the side effects of this treatment, right? Because these treatments are attacking healthy cells as much as the cancer cells. And part of
Yeah,
what it
a lot of immune cells and the gut lining are very much impacted by chemotherapy, but indeed it kills cancer cells.
So it's killing cells that duplicate and replicate the most quickly. So that's in your bone marrow, which is why platelets and white blood cell counts go down, because they replicate quicker and they don't last as long like red blood cells. Although there's some anemia that happens from the damage to the bone marrow. Anemia is also a problem. But platelet counts drop because platelets form from megakaryocytes that arise from bone marrow. And white blood cells also arise from bone marrow. It kills the lining cells of your intestinal tract because they replicate quickly. They only last several days, 3-4 days, a week at the most. So those are very susceptible to the chemotherapy drugs and getting damaged, which is why they get nausea, vomiting, diarrhea. Hair falls out, right? Because hair is also some cells that replicate and make more the follicles make more hair. So your hair falls out because those are susceptible. But the bone marrow, and this is a big problem. First of all, when you take down white blood cells, this person if you have cancer, you're already way out of balance. There's lots of things that are wrong besides just the cancer. No one's healthy and has cancer. They have cancer. They have all the stress and the worry of the cancer. Then they get overloaded with all these toxins from the chemotherapy. And then the bone marrow gets damaged. And so you can't make as many white blood cells. So now you're susceptible to infection on top of everything else. And that's a problem. Now there's a class of drugs called granulocyte colony stimulating drugs. And what that does is they help promote your body's ability to make certain types of white blood cells, but not all white blood cells, just the granular.
Absolutely.
So they can compensate somewhat for like bacterial infections, but it doesn't impact at all the lymphocytes because they're not granulocytes. Anyway, they also don't have any drugs to help with the platelets that drop. And platelets are not just really, obviously, if you don't have enough platelets, they're involved in clotting. So if your platelet count gets too low, you could bleed to death very easily. So if your platelet count drops below 100,000 or even 75,000 for sure, then they got to start thinking about stopping the chemotherapy until that recovers. So here's the beautiful thing about Beljanski's products. So part of what I did is my protocol for this woman to co-care her while she's going through chemotherapy is I gave her OnKobel-Pro and I also gave her Immunobel-Pro. So Immunobel-Pro, as was that purified RNA fragments, they act as primers for DNA synthesis of both white blood cells and the platelets. And of course, the chemotherapy is damaging this whole system. So if you can replenish the body with more of these primers, then it would only make sense. And of course, your father, Mirko, proved in his research that it would increase production of platelets and white blood cells. So if you think about it, aside from the horrible experience of the side effects of chemotherapy, that you see those pictures all the time, the vomiting, the nausea, the hair falling out, you feel miserable. It's, oh no, chemotherapy. And then halfway through going through this terrible process, their platelet count drops, or maybe their white blood count drops, or lymphocytes, but especially the platelet counts drop. And now they got to stop the treatment until it recovers. And then they lose ground. Sometimes they got to start over. Holy cow. How could that be worse? Wouldn't it be great if there was something that is completely safe, non-toxic, that we can give people while they're going through these treatments that would help protect the platelet count so they don't bleed to death, so they can continue their treatment, get it over with, and move on with their life. Things that could help protect and preserve their lymphocyte count, which there's no drug for that. And of course, that's what Immunobel-Pro and OnKobel-Pro can help do. And let me give you some numbers. This was very, now this is, look, this is what they call an N of one. It's one person. But if it's one person, it just really is just proof. It's more evidence that what your father found out to be true. I have more proof that it's definitely true. What happened with my patient as well. And this
Yeah.
is just one case because I have numbers.
Yeah, actually, when it comes to building up the number of platelets and maintaining the number of platelets, we had a clinical trial
Yeah.
a few years ago at Cancer Treatment Centers of America with patients. There was 32 patients enrolled at the time, different kind of cancer, different, all on the chemotherapies, different kind of chemotherapies. And what they had in common was they were all at the verge of thrombocytopenia, which is a loss of platelets. Technically, they did not have it. They were expected to develop thrombocytopenia with the next rounds of chemotherapy. And none of the patients that enrolled into this clinical trial developed thrombocytopenia. They were all able to go all the way through their cycles of chemotherapy. None of them developed thrombocytopenia. Their bone marrow was protected during the chemotherapy. Some ended with a better level of platelets at the end of the treatment than at the beginning of the treatment, after we had stopped giving them the RNA fragments, because it was kind of food for the bone marrow. You were mentioning my father. He wondered how the bone marrow is creating platelets, and it is using the nutrients that, of course, it gets from assimilation through the gut. But when you take chemotherapy, the gut lining is damaged. So it's a way to give directly under the tongue, so it's absorbed directly through the blood, the exact nutrients that the bone marrow needs to create, to do its job. And its job is to do all the white blood cells and platelets. So there is no imbalance. You were mentioning that with this chemical drug that is used in conventional medicine, the drug is not supporting the formation of lymphocytes. This is not an issue with Immunobel, because those RNA fragments just, it's nutritional approach to give the bone marrow what it needs. And it respects the body does its work. Mother Nature is absolutely perfect. And all the white blood cells, all the platelets created in physiological number.
Ever wondered about a supplement just for you? Introducing Womabel, made for the unique health needs of women, the natural choice for everyday wellness. Our formula, carefully picked, deeply researched, for real results. Packed with the power of Pau Pereira, exclusive green teas, and Rawolfia extract. Every capsule is a step towards better health. Hear from those who felt the difference. Visit our website, masonbeljanski.com. Unveil the power of nature through Maison Beljanski, sourced from nature, perfected by science. Get 15% off your first purchase with code EP2. Feel better naturally.
Yeah, well put, all of that. And my results, first of all, I got to tell you that this woman is 70 years old, okay? And she went through this treatment and then took the Immunobel and the OnKobel-Pro as I directed her to. And there was some other things, right? Other nutrients and other pieces that I gave her as well. But the research showed that this is going to help protect platelet counts. In other words, like you say, provide the fundamental nourishment that the bone marrow needs to make more platelets and white blood cells. Those other nutrients and botanicals didn't really have the research behind that so much. So I think that the platelet protection for sure, and even to a certain extent, the lymphocyte count, was coming from this Immunobel and the OnKobel-Pro products. And FYI, she went through she was scheduled for 6 cycles of chemotherapy. And after 3, now she had what they call above and below lymph nodes. So it was in her neck, it was in her armpit, it was below her waist, it was throughout her lymphatic system, as verified by a PET scan. And then after doing the protocols that they needed to do, plus the protocol that I recommended using Immunobel-Pro, OnKobel-Pro, and some other things, after 3 cycles, so halfway through, they went and did another PET scan to see if it was having any effect yet. And there was no evidence of cancer halfway through her treatment.
Yeah.
It was all gone. And she had, aside from losing her hair, she had no symptoms. Now, part of that might have been to some other things that she was taking and doing, but she had no nausea, no vomiting, no loss of weight. She continued to hike, except for the day or 2 after chemo. She was back to her normal self. And I was checking her body composition. She maintained most of her muscle mass. She didn't have diarrhea. All the traditional things that happened didn't happen with her. How much of that was happening from the Immunobel-Pro, the OnKobel-Pro? Don't know for sure. If I look at, I've been following her for years before this. So her average platelet count, normal is 175 to 400,000. And her average for her normal was about 180. So it was already the low end of normal range. But not any concern, except she's a lot lower to being too low to continue her treatment and get in danger if it gets too much lower. And again, if it gets below 100, certainly they already start thinking about changing what they're doing, and below 75 to stop and wait. And that's a problem. Anyway, her average level during her treatment was 204. So her average was 180 before getting on these Immunobel-Pro, OnKobel-Pro, before her chemo. Her average platelet count was low normal at 180, and her average numbers during the course of her entire chemotherapy treatment period was 10% higher than that, 204. And her lowest level during treatment was 113, and 1 week later it was 218, and they're waiting 2 weeks in between treatments for her.
Yeah.
So there was absolutely no concern. One time it dropped to 104, and then a week later it bounced back to 172. The rest of the time was 180, 200, 250, 280. Okay, so first of all, the fact that halfway through her treatment, there was no evidence, none. They were all scratching their head. This is amazing. It's a miracle that your father had these insights and followed through with it, despite everything he had to go through to do that. But it's not a miracle. It's good science, and it's physiology.
It's good science, and the science is published, and everything is available on the website of beljanski.org. Everybody can look at the research, download, share that with their doctor, and benefit from having this nutritional supplementation that will allow them to sail through chemotherapy without suffering too much of the side effects. Now you were mentioning Immunobel-Pro and OnKobel-Pro. OnKobel-Pro is a different product. The research, which also is extensive behind each of the ingredients of OnKobel-Pro, shows that both the pauperi extracts are very well known to have anti-cancer properties and in synergy with different kinds of chemotherapies, and also to fight cancer stem cells. We have seen that already against ovarian cancer stem cells and pancreatic cancer stem cells. The Beljanski Foundation has now an ongoing research program at Kansas University Medical Center for breast cancer stem cells. That's probably one of the reasons why there was no metastasis and no complication. We hear that again and again, that this product makes a real difference to help avoid recurrence and metastasis.
Absolutely. They did not even come close to, they were hoping to see some response after 3 of the cycles of chemo, not that they couldn't find any. And we know, or I've come to learn from the research with Beljanski, that the OnKobel-Pro, it helps the body eliminate destabilized DNA. The brain is continuing to function correctly. Or if it doesn't, then it has to trigger an apoptotic cell program cell death so that it dies. The problem is when it becomes destabilized, it doesn't die, and now it's got everything it needs to be a cancer cell. And what I'm understanding is that the main ingredients in OnKobel-Pro helps the body eliminate these cells when they have destabilized DNA.
Exactly.
Absolutely, I am convinced, and the research shows, and the research will continue to show, that the reason halfway through her treatment she didn't have any cancer is because of the synergistic effect of the OnKobel-Pro working at the same time.
Oh, yeah, we have seen that. I'm delighted to hear that your practice is also confirming this. So, this is for people undergoing chemotherapy. Now, not everybody is going. Some people are just coming interested in prevention, or they have finished their rounds of chemotherapy and what to do next. How do you help them? Are you supporting those patients?
Let's keep talking about this particular woman. So we know that the chemotherapy wasn't killing the cancer stem cells. And we know that the OnKobel-Pro has ingredients that has research to show that. Do I know in this particular person sitting in front of me that if they do the OnKobel-Pro during chemo, that all the cancer stem cells are taken care of? We don't even know exactly how this got a foothold in the first place, because she eats well, she lives well, but there's factors that we don't know about, right? We don't know if the little bit of chemical exposure was the trigger, but what I do know is that I recommended that she continue to take the OnKobel-Pro at a lower dosage. And from what I understand, it can be pulsed. So you can do it. It has a lasting effect. Then you can stop it. Then you can return it. That's what I recommend with
Absolutely.
breast cancer. If you're at a higher risk, you're taking the Womabel-Pro, which has some of the identical ingredients. So I just continued. And in fact, until her white blood count, because now she's not taking any drugs to artificially boost her white blood cell count. So now we just continued to use the Immunobel-Pro. We dropped it twice a week instead of 3 times a week. I lowered the dose of the OnKobel-Pro, and then we did a period of time where we paused without it. Anyway, we're coming up on 2 years that she's cancer-free, but she was cancer-free according to their standards halfway through their chemo, 2.5 years before that. So why not just continue taking things that help keep cancer stem cells in check? I kept going with the Immunobel-Pro until we got a good we got our lymphocyte. I could happy to say that we finally got our lymphocyte count up. We've got it up to her average lymphocyte count was 1,000 before the chemo, and then it dropped and it stabilized, but it didn't get too low. Now we got our lymphocyte count back beyond what it was before she ever had any cancer or chemotherapy. So anyway, the moral of the story is, what do? I do the same things that I do during treatment, only lower doses, maybe pulsing. The diet, the lifestyle, the healing, the focus, all that is, and like you said, it's a journey. You just keep doing it, and then you'll be even grateful. That's one thing about these cancer patients. When they come out the other end and they're given a clean bill of health, meaning that they can't find any cancer cells with standard technology, these people, when they heal from this, they have a whole nother level of sense of gratitude and not taking things for granted. And these are really cool people to be around. I love being part of supporting that journey.
That's fantastic. How can they find you and benefit from the products that you mentioned today?
Yes, obviously I have limited capacity to see people, which is why but you can let me answer the first question. I created an online learning health resource called intelligenthealthnow.com. So if you go to intelligenthealthnow.com, you'll be able to make an appointment according to availability. But because I'm only one person and there's 4 billion women on the planet, and that breast cancer is still the number one cause of cancer in women if they don't smoke, because lung cancer, of course, is very popular still. So I created an online course that people can walk themselves through all these fundamental things that I'm talking about, including supplements that help push them away from cancer and lower their risk. And that includes, especially if they're at high risk, using Beljanski's Womabel formula, which helps target breast cancer stem cells. So again, every woman has breast cancer stem cells happening. And if you're not diagnosed, it's because your immune system has kept them in check naturally. And, or maybe it's forming and you don't know it yet, right? It's not about panicking or worrying. It's about taking proactive steps that we know from the research can help move you away from the direction of breast cancer. So I took all my recommendations from the research, how to monitor your breast health most effectively, how to do a self breast exam the right way, what supplements to take, what are the diet and exercise and lifestyle pieces, what's an anti-cancer mindset, what does that actually look like, and what to do about it. And I make it really easy and simple for people to walk themselves through this program. And the side effects of the program is it reduces your risk for all cancers and degenerative diseases in the same place.
Exactly. And that's why people sometimes they start with one cancer, and if it's not addressed properly, if it's the issues are not solved, then people get another cancer a few years later because the root of the problem has not been addressed. Absolutely.
And sometimes the treatment for their cancer, especially chemo, radiation, it damages other systems, and now they have autoimmune disease they got to deal with.
Yeah,
So, look, my passion for the rest of my life is to help people not get there, not get these diseases, because once you get them, it's a long journey. My passion is to help people learn and inspire them to take action before they get these diagnoses so that they don't. Anyway, if you go to intelligenthealthnow.com, you can book appointments on that website, and you can also hit the link that tells you more about my breast cancer prevention course.
excellent. Thank you so much, Dr. Powers. So you said you are in Florida. For people who want to move and see you in person, where exactly in Florida?
So I'm in Stewart, which is southeast, so West Palm Beach, and then me.
Beautiful area. I'm sure that people can manage to get a vacation, winter vacation, and
There
come
you
to
go.
see you. Absolutely. Definitely worth the journey, worth the travel, and being treated as a person, not just as a disease, being listened to, having a compassionate doctor
Yeah.
that will the mind, the soul, the heart, and also all the proper nutritional approach that we need so much to take care of us, whether actually we are sick or not, and whether we choose conventional treatment or not.
And again, I'm not against any. Look, that's why it's called integrative medicine. Integrative medicine is where you integrate the best of whatever's available and known based on what's
Absolutely.
right for you, what feels right. But you got to know what the options are and how they work together, like synergistically, like I've been doing with this other patient. It integrates everything: mind, body, mind, the whole thing, your heart, your diet, your lifestyle. It's not about one's right, one's wrong. It's about how can we integrate everything that we now know so that you can live your best life and facilitate your healing.
Absolutely. Thank you so much, Dr. Powers.
I'm so grateful for you and your father and your team. I personally believe that work and what you've continued, because the work is useless unless you make it available, which is what you did.
Absolutely.
And God knows the obstacles you had to go through and continue. So I'm so grateful for that. And so are every one of my patients and anyone that has the fortune to learn about what you guys offer.
Thank you so much. Thank you for your kind words. Thank you for trusting us and having tried the products on your patients and be confident you would see the results. Thank you for that.
Yep, my pleasure.
Thank you very much.